My name is Pamela Patton, and I'm from Grand Rapids, Michigan. So eventually, both of my knees became bone on bone. Really impacted my day-to-day living. I could not stand up straight, and I just knew the quality of my life was diminishing. And I knew eventually I was going to have knee replacement.
She had arthritis in actually both her knees. Her knee angle and function was only going to continue to get worse, and so she opted to move forward with knee replacement surgery. We can get size, shape, and dimensions of the implant that we're going to use specific for that patient all prior to surgery. I think it's a far more accurate way of placing the implant, and in Pam's specific instance, it kind of helped me know the degree of loss of motion of her knee and what we're able to kind of recreate, and also the angle and alignment of her knee long term.
I'm at 6 weeks and I'm still doing physical therapy. I was just amazed at how my knee was functioning already and how much better it was functioning compared to before the surgery. I wholeheartedly recommend Dr. Johnson and Holland Hospital Bone and Joint Center.